Good afternoon and welcome to our daily media briefing. Yesterday we talked about the reopening to the public of some county offices, starting tomorrow and being phased in over the next week. Today I'm happy to announce more good news about one very popular county department, and that is going to open very soon. Beginning May 26th, we will open 6 of our county branch libraries for doorside service. Those 6 libraries to open are Imperial Beach, Alpine, Ramona, Encinitas, Vista, and Borrego Springs. Customers will be asked to pick up library materials that they have reserved through our online catalog. Library staff will call or email customers to schedule a pickup from one of the 6 library sites. On June 1st, we will open 6 more of our county libraries with the same service model. Those libraries will include the Bonita, Poway, El Cajon, Julian, Solana Beach, and San Marcos libraries. If you have books that you've been wanting to return, don't worry about returning them for now. Keep them and reread the good ones. You won't be charged any late fees. We will also be making census kiosks available at those locations. Even with this pandemic, it's really important to complete the census as it determines how much money goes to the region for critical services. And don't forget about our robust e-library. You can enjoy books, audiobooks, ebooks, and digital magazines anywhere. For more information about our e-library and hours of operation, for the libraries that will be opening up for doorside service, visit our county library website at www.sdcl.org. As you can see, over the last few days, we have made great progress in reopening businesses and increasing access to regional activities, while at the same time working to bring this pandemic under control and save lives. But we understand that that's still not fast enough for people who are out of work, merchants who have shuttered their doors, and others. We have heard you, and we understand the enormous impact and pain this has caused on workers and business owners. We have tried to reopen while trying to strike the right balance between saving lives and jump-starting our economy and society. Our success in slowing the spread of the virus and limiting impacts to our hospitals has allowed us to take another big step. That's why late yesterday, the Board of Supervisors met in closed session to analyze our legal options on reopening, and we directed our Chief Administrative Officer to work with the state on a plan to accelerate reopening businesses in a safe manner. We have made clear that we're really no urban county can meet the current acceleration criteria that was put forth by the state. But the state has allowed for a process to have regions move faster towards reopening. So our goal is to work aggressively within that process and submit alternative data that we believe supports an accelerated reopening that protects both workers and the public. We will discuss this further on Tuesday at our regular Board of Supervisors meeting, which the public will be able to access online. We want to work with the state on an accelerated reopening, and as we have said before, we believe we should have more local control of how and when we can reopen businesses. But let's be clear, even if we succeed with this effort, it won't be like flipping a switch or touching a dial or pushing a button that will bring everything back online in one moment. It's going to take time for businesses and others to wisely and safely prepare for reopening. It's going to take time for customers, shoppers, and others to feel safe about venturing out. And if conditions change with the virus, we will have to reevaluate everything. The truth is this virus is not going away anytime soon, and we can't afford to let our guard down. But we will look forward to having a thorough and robust discussion on Tuesday, and we certainly look forward to that and welcome the public for to join in with their comments. Thank you for your patience, and now it's time for Supervisor Fletcher to give us the latest numbers and data.
Thank you, and good afternoon. We have a couple positive updates to share on a couple different things. Since the very beginning of confronting the coronavirus pandemic and outbreak, we've talked a lot about the need to help and protect our vulnerable populations. We know our senior citizens are particularly at risk from the impacts of coronavirus, and we know that a lot of them do have underlying health conditions. We've asked them to quarantine even more than the general public, and that's created great challenges and difficulties. But as Dr. Wilma Wooten stated yesterday, their lives are no less valuable than someone else's life. And so we have to continue to take proactive steps to make sure that we are supporting, helping, aiding, and assisting both those with underlying health conditions as well as our seniors who are out there who in many instances are struggling from a number of challenges, both in terms of isolation and anxiety and concern, but certainly the availability of reliable quality food is a very important component of ensuring their overall health. A number of years ago, I sat on a plane next to a longevity expert who studied people who lived into their hundreds, and I said, well, what is the secret? And he said all of those individuals generally had things in common. They had a purpose, they had companionship, they stayed active, and he said they ate a good, healthy diet. And so today I'm pleased to announce that we are moving forward with our adoption of the Great Plates Delivered Home Meals for Senior program. This is a partnership with Governor Gavin Newsom and the state of California to bring this program to San Diego County. A committee including representatives from the county's aging and independent services teams and selected local restaurants are joining forces to select restaurants that can participate in this program. In order to participate, the restaurants needed to be able to meet both the volume and the nutritional standards. They needed to use local produce and meats. They had to prioritize local worker retention. Now that we have the restaurants signed up, we are ready to launch this program. It will immensely help seniors who are at home, who are under the stay-at-home orders. And so starting today, older adults in San Diego County can apply. Now, before we get to the information about how to apply, it is important to point out that this program is intended to fill a gap for seniors who are not currently able to access other feeding programs. And so this program is only available for seniors who are not currently receiving or eligible for other federal nutrition programs such as CalFresh or the Senior Nutrition Program. So if you're a senior who is not already receiving federal assistance program, then the Great Plates Delivered Home Meals for Seniors is for you. We have a slide here to talk about how you will sign up for this. This program delivers 3 free meals a day delivered to you. Again, you see the qualifications: seniors not receiving or eligible for programs such as CalFresh or Senior Nutrition Program. And you see the sign-up details there, the website, aging.sandiegocounty.gov/greatplates, the phone number 800-339-4661 and press 7, or you can always call 211 for help and assistance. Capacity is limited to this program, so we encourage you to apply soon. We expect this program to run at least through June 10th, and then we will see the status of if it's able to be extended or not extended. This is not only a great program for our seniors, but this is a great way for us to continue to engage and support our San Diego County restaurants who are struggling during this difficult time. And so we're grateful to our restaurant partners, to our staff in Aging and Independent Services who helped pull this together, and of course to the governor and the state of California for launching this program. Quick update on testing at the Convention Center. 19 more tests have been performed from yesterday, 11 residents, 8 staff. There's still no change in the results, a little bit of lag in getting the results, but we will share those with you as we get them back. I also wanted to share, you may have seen, I believe, the Air Force put out a notification, but tomorrow the U.S. Air Force Thunderbirds will be performing flyover tributes to our healthcare workers at our area hospitals. This will be taking place around noon. So around noon, if you look in the skies of San Diego at various San Diego hospitals, you may see 6 U.S. Air Force Thunderbirds flying a little lower than they normally do. And it is a great tribute to our healthcare workers and a reminder to us all that despite the challenges and the difficulties that so many of us face, our healthcare workers remain on the front lines. They show up to work, they treat individuals who are not only suffering from coronavirus, but everything else out there. And so it's a wonderful way to honor and pay testament and treatment to those healthcare workers and express our appreciation and gratitude. And they're really cool to see 6 of these flying in formation really low. So if you have a chance, don't go to a hospital and congregate. Don't congregate anywhere. But if you look in the San Diego skies around noon tomorrow, you ought to be able to get a good look at them. We have not been updating on a daily basis. We've been updating on a daily basis. We have not been sharing on a daily basis the personal protective equipment slide that we were using for quite a while. But I did want to highlight a couple milestones here. We've now surpassed 3.8 million individual items of personal protective equipment that's been distributed. That includes more than 1 million N95 respirators, more than 1 million gloves, along with more than 1.5 million face masks. There is an entire team here at the county that works tirelessly 7 days a week to find every possible supply chain where we can acquire personal protective equipment, whether that's through the state or federal government, acquiring it on our own, partnering with area churches on repairing things, taking donations and processing them and making them available. They are doing incredible work and literally moving millions and millions of items on a daily basis, and we appreciate their efforts and their support, as do, I know, our area healthcare systems and others that have received this personal protective equipment, and that work will continue as personal protective equipment is going to be a part of our daily work as we progress all the way through the coronavirus pandemic. Jumping into our T3, we had a big jump in testing today. We got really, really close to the 4,000 number for the time being. I wish we could have just found 2 more people to get to 4,000, but we are pleased to report our single highest day total in testing, 3,998 individuals tested. Again, we're going to see day-to-day fluctuations. You're going to see numbers go up. You're going to see numbers go down. We know that we have a lag coming out of the weekends. But this does reflect the ongoing commitment and effort to see a sustained upward stepping of our testing, not capacity, our testing being actually completed and done. We're also creeping up soon in the coming days to where we will hit over 100,000 total tests reported. 171 tracers. Those are folks who are out, trained, staffed, working. We have a whole group of them that are in the onboarding and training process, and so we expect this number to continue to jump. And these 2 numbers, again, go together and provide a vital foundation of our ongoing efforts as we open up the ability to rapidly and widely test, identify positives, isolate them, contact trace their close contacts, test those individuals, and those efforts are a part of being able to contain the spread moving forward. We're presently treating 194 individuals in our public health motel rooms for 674 total. Next, you will see today we're reporting 113 new positive test results. Again, that is out of our single highest day testing results of 3,998 for a 3% total. We continue to believe that as we continue to expand testing, that the percentage of positive will continue to go down because we are hitting a wider sampling or less dependent on those individuals who are sicker and more likely to be positive. And so continuing to see this go down is good, but is also expected as the testing goes up. Next slide is our hospital system capacity. You see ICUs up slightly there at 146. Total hospitalizations for COVID down just a little bit at 380. And again, that 380 number, when you look at that on top of those in our hospitals for non-COVID related reasons, you can see 380 as a part of 3,870. 380 there is a part of 3,870, and you see that under the total hospital bed system capacity for our region. Lastly, we will just take a look at the cumulative positives, 5,391, estimated recovery, 3,364, cumulative hospitalization with a doubling rate of 30 days, cumulative ICU, and then the unfortunate loss of life today hitting the 200 mark, which is a reminder that despite all of the actions and steps we have taken, this still is a deadly virus and disease, and had we not taken the actions and steps we've taken, we have been presented with information from UCSD, this number would now be around 13,000. And so the actions we've taken have saved lives, have given us the ability to come out of this in a smart and sustained way and to begin to rebuild our economy but it is a reminder that the danger is still present and still out there, which is why we ask the public's continued help in adhering to our public health orders. With that, I will turn it over to Dr. Wilma Wooten for her Public Health Officer's report.
Thank you, Supervisor Fletcher, and good afternoon, everyone, and thank you for joining us this afternoon. The global, national, and state statistics today are based on data from the Johns Hopkins dashboard, and these were obtained at about 8:30 a.m. today. So the information is as follows. Globally, there are over 4.4 million positive cases, including over 300,000 deaths. Nationwide, the United States is reporting over 1.4 million positive cases, and this represents 32% of the global number and includes almost 85,000 deaths. Statewide, California is reporting over 73,000 positive cases, and these include almost 3,000 deaths at 2,974. And today, the County of San Diego is reporting 5,391 cases, which is 113 more cases than yesterday, and includes 200 deaths, which includes 6 new deaths being reported today. So, of the total number of cases, 2,500 or 60% are Hispanic, 1,078 or 26% are white, 174 or 4% are Black or African American, 347 or 8% are Asian, and 43 or 1% are of multiple races. We do not have 38 or almost 1% are Pacific Islander, and 10 or 0.2% are American Indian. The age range remains the same, 3 months of age to 101 years of age. We have 2,788, or 52% of the total number of cases are in individuals between 20 and 49 years of age. And 49% of the total cases are female, and 51% of the total cases are male. 1,047, or 19% of total cases have been hospitalized, and this includes 321, or 6% of the total have been admitted to the ICU. This number is 31% of the total number of those hospitalized. Of our 200 deaths, these represent approximately 4% of the total number of cases. Of the 6 additional deaths being reported today, the age range is from 73 to 98 years of age, and all had underlying medical conditions. Of all of the 200 deaths, 42.5% are female and 57.5% were male. Regarding race and ethnicity of all deaths, we have data for 91%, which is 181 of the 200. And this means that we do not have race and ethnicity for 19 individuals at this time. The numbers have not significantly changed from yesterday. And you can find these numbers and these data on our county's website that is shown at the bottom of this slide. Our sympathies, as well as our condolences, certainly go out to the families and the friends of the individuals that we reported here today who lost their lives due to COVID-19. So in regards to reported outbreaks in congregate and community settings, to date there have been a cumulative total of 68 confirmed active outbreaks. Of these, 46 are in congregate facilities. We have 3 new outbreaks today since yesterday, with a total number of congregate cases now at 1,241, which includes 93 deaths. And we also have 22 active outbreaks in community setting locations, which includes 258 cases and 5 deaths. We are now 1 week into stage 2. As we continue to plan for an accelerated stage 2 and even stage 3, we continue to monitor the federal gating criteria as well as criteria identified by the state. and this helps us to continue to monitor San Diego's progress. Yesterday, I was asked about casinos opening next Monday. At a previously scheduled meeting, this morning I had the great opportunity to meet with the representatives from our local tribal nations. And we discussed a wide range of COVID-19 topics, including reopening of the casinos. It is very clear to us that tribal nations have sovereign authority. And it is also very clear that the county and the tribes share a mutual interest in protecting the health of the community. So to date, a few casinos have submitted their plans for reopening to the county, and others will be doing so today, and I will be reviewing those plans today as they are planning a phased-in approach, and these approaches align with the current state phases. We are will continue to work with the tribal nations, and again, understanding that we both have the same mission and goal. So in the end, we are all in this together. Currently, our local metrics are trending in the right direction, and I want to continue to remind the public of that, and this is due to the great success of most individuals obeying the health officer order. We will continue to aggressively monitor these data to support further opening of our local businesses. One last message I'd like to leave with you is this, that there are 4 things that we believe that our businesses and our healthcare system and organizations can do to help stop the spread of COVID-19. And those 4 elements include, number 1, hygiene and sanitation, washing your hands frequently and cleaning your environment on a frequent basis as individuals go through the environment. Social distancing is very important as we begin to reopen, as well as using the face coverings. And the last is screening. We have included the guidance on screening in the social distancing and sanitation protocols, and we recognize that obtaining thermometers might be slow in doing so, but we still encourage businesses, organizations, as they allow individuals to come back to work, to screen, develop a process by which they can screen their employees. And we just continue to thank you for your effort, and we will continue to monitor our metrics and report back to you accordingly. Now, please welcome back to the podium Supervisor and Chairman Greg Cox.
Thank you, Dr. Wooten. We'll go to our first call.
Elliot Spaggett with the Associated Press. Please state your question.
Thank you. I just wanted to clarify on the casino reopenings. There are 3 that I know of that have announced on their websites very specific plans to reopen next week. The AHUS, Monday at 8 a.m., Sequan, Wednesday at noon, and Valley View next Friday at 8 a.m. I'm wondering if those, what you think of those plans, whether those plans comply with state and local rules. Dr. Wooten, you said you would be reviewing their plans. If they don't comply with the state or local rules, then what happens? What avenues are available to the county?
Okay, Dr. Wooten will respond.
Sorry. Yes, I stated in my comments that I would be reviewing. We had the meeting this morning, and I will be reviewing all of the plans today. So if you have them, you have them. But again, I want to point out, as I stated, tribal nations have sovereign authority. So our plan is to review, our strategy is to review those plans with them and provide guidance and advice where possible.
Okay, thank you.
Okay, we'll go to the next question.
Artie Ojeda with NBC7. Please state your question.
Good afternoon, everybody. I'd like to follow up on the casino issues. Dr. Wooten, specifically, you have clearly softened your tone on casinos reopening compared to yesterday. Do you still think that they should not reopen? Are they still, a public concern? Do you think they should not reopen? And I'd also like to get Supervisor Fletcher's opinion on that, if you think it's a good idea for the casinos to reopen.
Okay, we'll ask Dr. Wooten to respond and Supervisor Fletcher.
Thank you for your question. Yesterday, I had not spoken with the tribal nations, and in our meeting this morning, they have stated that they are implementing a phased-in approach. So I am going to work with them to do just that. While we recognize that casinos are in stage 3 of the governor's plan, tribal nations are sovereign entities. So that's my position today. Thank you.
Look, I respect the sovereignty of the tribal nations. This is a decision that is for them to make, and there is a very long and very dark history in this country of white people in particular telling our Native Americans what they should and shouldn't do. And I'm not going to be a part of continuing that into the future. I respect their sovereignty. I respect this is their decision to make, and I appreciate the effort and energy they're expending to coordinate that, share those plans with our public health officers, and seek advice and input as they move forward, which is their choice to make.
That's understood. Do both of you still think it's a good idea to reopen the casinos?
Yeah, thank you, Artie. I think I've addressed your question. I may not have answered it in the format you want, but I think I've addressed it, that it is not my place to tell them what they should do.
Thank you, Supervisor Fletcher.
Okay, let's go to the next question.
Lindsay Pena, 10 News, please state your question.
Yes, my question is still on the casino issue. Is it my understanding then that after Dr. Wooten's meeting today, that the 3 casinos we'd already been notified about reopening next week still intend to reopen next week?
Okay, I'll ask Dr. Wooten if she can respond.
So I guess let me be clear about what we have stated today. Both the county in general, not just me as the health officer, recognize that our tribal nations have sovereign authority. So our plan, my plan, is to work with the tribal nations to work with them to implement the strategies that are outlined in their plan so that the individuals that will be exposed as they reopen will be protected. And they have that same mission and goal. We both have the same goal. So we will be working with them to make sure that they follow the social distancing strategies, masking, and those 4 strategies that I talked about at the end of my presentation: hygiene and sanitation, social distancing, masking, and screening. Thank you.
Okay, we'll go to the texted questions now. The first 2 questions deal with the metrics on classifying COVID deaths and some issues related to the border, and Dr. McDonald's going to respond.
This question is from Kim Miller with ABC 10 News. What metrics are you using to determine COVID deaths? Are all of the deaths in San Diego County confirmed positive cases of COVID through testing prior to death, or is it assumed some deaths in the county are likely related given the lack of widespread testing early on in the pandemic?
Sure. Questions have come up before about how we categorize and classify deaths that are related to COVID. And we in the county do the same as the state and all the other jurisdictions within the state and actually across the nation. We use very specific definitions that is promulgated by the Council for State and Territorial Epidemiologists and the CDC. And those definitions actually have confirmed cases and probable cases, and we only report confirmed cases in San Diego, and that means it is an individual who had signs and symptoms of COVID disease that was related to their death, and that they have a positive PCR test for the virus either before death or just after death. And the question asks, what's the ratio of those? Almost all of them are individuals who are tested before they die. We have perhaps less than a handful of cases that are individuals that were tested after death. The natural history of COVID is generally one that does not usually result in a rapid death, although sometimes when they present for medical care it can be rapid. And we usually have enough time to be able to get tests done and to connect that to the care of the patient, and then unfortunately some of them die, and we are able to include that in their death certificates. If individuals have looked closely, the numbers that we report here in San Diego are slightly lower than that reported on the state's website. That's because the state is using a different data source. They are using data from the Cal OES system that comes directly from death certificates, and their number is slightly higher because they actually sometimes will include non-residents who die in the county amongst their deaths. They don't discriminate where someone's residence is. They only report on where someone died. We do not include those non-resident deaths in our numbers. And sometimes the diagnosis of COVID will be placed on a death certificate, but when we do our research, there isn't a positive test, or the tests that were used were not PCR tests, and therefore they were probable cases, and they may be counted in the state numbers, but they are not counted in the cases that we report here at the county.
All right, thank you. And this one is from Juan Carlos with Telemundo. Have you registered an influx of patients from Mexico to Chula Vista and other border communities? Is this a natural process due to having binational population, or does it have to do with the problems with access to quality care in Mexico? Can San Diego respond to these people in need of care?
Well, that's about 5 questions all in one. Let me do the last one first, because it may be the most important. What can people in San Diego do to help our neighbors and family and friends and colleagues in Baja California? You can donate to the International Community Foundation. They actually are directly procuring material that they go through the Mexican consulate to provide for those in need in Mexico. There are actually many other wonderful philanthropic organizations that are doing medical care support and humanitarian support to what's going on in both Tijuana and throughout northern Baja California, and I would urge the public to actually contribute to those efforts, because the need is great. We in the county are part of a task force that involves the city, state, and federal partners that are closely monitoring what's going on at the border. The number of border crossers is down significantly from before COVID. I would say it's a little over a third of what it was in the past. But we are actually closely monitoring individuals who cross the border who may have signs and symptoms of COVID disease. We're monitoring ambulances that originate with patients or individuals presenting at the border and coming for health care. And we're working with our hospital partners really across the system, but most closely with Sharp and Scripps, because of their hospitals in Chula Vista, to monitor the cases that are coming in that are related to COVID. We do know that a significant number of individuals who are presenting for care in the southern South County hospitals are individuals who endorse some travel within the 2 weeks previous to the onset of their symptoms. And it's at least a third that they themselves have been there within the last 2 weeks, but probably another third that have direct contacts with individuals who have crossed the border. This is not unusual for a binational community like San Diego and Tijuana. So with the number of cases that are occurring there, it's not unexpected that we would see an increased number of cases presenting here in predominantly U.S. citizens, but also permanent legal residents and essential workers who cross the border who are presenting for care. We do know that the hospital systems are very stressed in Mexico, and that may be contributing to some individuals seeking care across the border, but I wouldn't make a blanket statement to that effect. Did that answer all the pieces of the question? I'm not sure. There were about a bunch of questions there.
I think that was pretty close. If they have a follow-up, they can text us. and we
Okay,
can do
thank you.
that afterward.
Okay, this next question deals with homemade masks, and Dr. Wooten's going to respond.
Yes, this one is from Claudia from Univision. Vendors across the county are now selling homemade face masks. What recommendations do you have for people buying these products? Should they seek certain types of fabric? Are the so-called filters inside the face masks effective? Or, as you've said in the past, is a scarf a good enough protection?
Yes, when we first issued the health officers, or modified the health officers' order to include face coverings, we included information from the California Department of Public Health, and which includes a link to the website where you can find out how to make. And if you Google facial coverings, there are numerous information on the internet about how to make a facial covering. Usually it's just really anything out of cotton and cotton cloth. That's really the most important. And this is totally different from the simple surgical mask and obviously from the N95 respirator.
All right, thank you, Dr. Wooten.
This next question has to deal with childcare, and Supervisor Fletcher is going to respond.
This question is from Tyler from News 8. Why can childcare facilities be open for adult-child interaction with close contact, but children cannot have close contact with family members in other households, for example, a 2-month-old meeting their grandparent? Is the risk any lower or higher to pass or contract the virus at a child care facility versus family-to-family close contact? And if they are the same, why are there so many restrictions on family-to-family close contact, but not child care facilities?
Yeah, thank you, Tyler. I think we all understand the frustration of all of the restrictions and limitations that have been put in place. If you go back to what is essential businesses, what is not, there are a series of decisions that have to be made in order to try and limit the spread and limit the danger. But we also have to do those limitations in a way that ensures that the essential jobs and the newly reopening jobs can actually function. And so childcare is an essential service because you can't expect healthcare workers and first responders and other even reopened businesses to be able to go to work without having the availability or opportunity for childcare. And so it is an essential component of everything that we do. Those childcare facilities operate under strict guidelines. They operate under very strict hygiene standards. They operate under very strict rules about limiting the number of kids that are together, along with limiting the number of adults who interact with those kids to do that in the most appropriate way. We certainly all want to get back to a point where families can gather outside of households, and we hope to get there soon. But until they're there, we have to get the essential parts of our economy, the newly reopened parts of our economy, up and running. So childcare is a vital component of that, which is why childcare is available when some other opportunities that may seem like they fit into the similar structure are just not at this point, but hopefully soon.
Supervisor Fletcher, I have another question. It's from Heather Casas. I'm trying. With Univision. My question is, what business will qualify for the accelerated reopening of San Diego County?
Well, I think you have to, one, we have to see what the Board of Supervisors ends up submitting to the governor, and then we have to wait to see if the governor approves it. So I would encourage you to tune in to Tuesday's board meeting to see the proposal that will be put forward by the county. But again, for that to become a reality, the state of California is going to have to sign off. In the meantime, while we await that, we will continue to move through stage 2, consistent with the state. Last week, we opened large sections of retail, warehouse, manufacturing, supply chain, logistics. Earlier this week, we took additional steps forward into business services and some other types of entities. And so I think we will continue to progress consistent with the state of California while our county seeks to be able or allowed to go on an accelerated timeline.
Thank you, Supervisor Fletcher.
This next question deals with some of the protests that have happened over the last week or so, and whether there's any COVID positives that have come about as a result of that, and Dr. Wooten will respond.
Yes, this is from Matt Hoffman with KPBS. I know Dr. Wooten said while it might be hard, the county would look to see if people contracted COVID-19 at recent rallies and protests against restrictions in our county. Do we know yet if any of those cases can be linked back to demonstrations?
To my knowledge, we have not linked any cases or outbreaks back to the protests.
All right, thank you, Dr. Wooten.
Well, that concludes our questions for today. We're going to wrap it up pretty quick today, so we thank you for your attendance, and we'll see you tomorrow at 2:30. And please remember to stay in place, maintain space, and cover your face. Thank you. We'll see you tomorrow at 2:30.